After Dr. Sodeke said amen, I said amen and got up and forgot that I was supposed to introduce it. I went to go consecrate myself and get ready for that call to action. But and I'm laughing, but you all, what I love about the convening today and what I love about the conversation is that we bring our full selves to this work. And some people may say, well, you all are talking a lot about spirituality, a lot about, but we bring ourselves to this work. And one of the reasons why it was so important for us to have this conversation here is because when you think about what spaces and places that the African American church has always been a place and a space for us to tell our truths and for us to hold other people accountable, hold ourselves accountable, and create spaces for us to learn and also disseminate information. It's been that historically for us. So I'm so excited to be here today, but I'm also excited to introduce the moderator for this panel, who I have I'm so proud of. I'm proud of the fact that we're raising up the next generation and the future. Dr. Atiya Shaheed is a proud native of St. Louis, Missouri, and currently a graduate student at Tuskegee University, where she is working on a dual Master's of Public Health and PhD in interdisciplinary pathobiology, emphasizing in epidemiology and risk analysis. Her undergraduate career was completed at Xavier University of Louisiana, where she obtained her Bachelor's of Science in Public Health. Her current research involves decreasing the morbidity and mortality rates of Black women living with HIV, HPV, and cervical cancer within the Black Belt region of Alabama. She previously won the second place in the All of Us Minority Research Symposium funded by the National Institute of Health for her research on cervical cancer disparities within the United States. She is now a representative for the annual Symposium Advisory Committee, as well as the Macon County All of Us Advisory Committee. After graduation, she aspires to become a professor at a HBCU, hoping to give to other students what her profession has poured into her. Thank you so much.
Thank you all for having us and for being here for our third panel and our final panel. It's been a wonderful opportunity. Happy Black History Month also. And so it's my esteemed pleasure to be here and to introduce the panel. And also, I want to thank Dr. Watson and all of us. And then I see people who are, I'm looking at Dr. Joy over there, Dr. Johnny, my advisor, Dr. Abdallah, because all of those people poured into me. And without them, I would not be here. So I'm very thankful for them and Tuskegee University. Yes, ma'am. Yes, ma'am. Can you guys hear me? Yeah. Okay. So I'm going to start by introducing Dr. Clayton Yates. Dr. Clayton Yates is a professor of biology and is an internationally recognized expert in prostate cancer health disparities research, cell biology, and molecular pathology. Dr. Yates currently holds appoints in the Center of Cancer Research and Joint Appointment of Material Science and Engineering at Tuskegee University. He is also an adjunct faculty at Clark Atlanta University, Department of Biology, Department of Pathology at University of Alabama at Birmingham. Additionally, Dr. Yates has identified multiple biomarkers for prediction of aggressive cancers in African Americans with prostate or breast cancer, and this has led to the development of a novel therapeutic for African American breast, prostate, and pancreatic patients that is posed to enter into clinical trials. That's Dr. Clayton Yates.
Thank you. Very happy to be here.
Next, Dr. Chastity Bradford is the department head of biology and an associate professor of biology at Tuskegee University. Her career has focused on cardiovascular research, diversifying STEM, a community-targeted approach to blood pressure monitoring and control. She has been responsible for rural Black Belt community participant recruitment, virtual program planning, and blood pressure training. Dr. Bradford has a pretty extensive list of accomplishments and has served at the field of research, including having trained and mentored 4 PhD students, 3 master's level students, 25 undergraduate trainees, 7 high school students, 2 junior faculty, and 2 K through 12 faculty. Dr. Dunn is the hallmark PhD. She has been innovative in improving the lives of people. She is the first in several areas of administration. One that she is very proud of is being elected the first woman mayor of the city of Tuskegee. Currently, Dr. Dunn is the founder and president or CEO of the Tuskegee-Macon County Community Foundation, TMCCF. It is a 501c3 public charity organization that manages philanthropic dollars, addresses community challenges, and develops public and private partnerships. The primary focus of this organization is the reduction of health and economic disparities and the development of equity strategies for rural communities, excuse me. Dr. Dunn. And last but not least, Dr. David Hodge is the Associate Director of Education and Associate Professor at the National Center of Bioethics and Research in Healthcare at Tuskegee University, the Senior Associate Editor for the Journal of Healthcare, Science and Humanities, and the Director of the Bioethics Honors Program. He has written 3 books: God of Our Silent Tears, Women of the Bible, Healing Women of Today; In the Midst of My Tears, the Bible Speaks to the Abandonment, Betrayal, Rejection, and Loss; and God of Our Silent Tears, a 5-week journey. Dr. Hodge is presently in the research and writing stage of 2 books: Pragmatic Bioethics and Intersectionality, Public Health Ethics, Bioethics and Marginalization, and Jesus, Trust, and Virtue Ethics, a philosophical theology of trustworthiness. He came to Tuskegee University from a sister HBCU, Florida Memorial University, where he gave leadership to the Religion and Philosophy Department for almost 2 decades. Dr. Hodge. So to start our panel, our first question will be posed to all of the panelists. So given the history of how things have been done and seeing the evidence of disparities impacting access and treatment to communities of color, what should be a step in collaboration process between researchers and the community? Dr. Yates, we'll start with you.
That's a really great question. And it's actually very fitting because I'm gonna have to sort of quote someone who taught me this when it's Dr. Shodake. It actually starts to start with trust, right? And trust is not just something that's given. You have to be trustworthy in order to be able to gain trust. Again, quoting Dr. Shodake. And so, as we have, sort of started or gone through our journey, we can see that trust sort of manifests itself in many ways. For example, trusted providers, having people who take care of you from the community that look like you. We have trust in, navigation. We have trust at the, nursing level, the intake level. So there are various levels of trust, but I think the overarching sort of theme of this is that we have to gain trust or have trust in our providers in order for us to feel that and to feel that they're trustworthy in order for, to improve better outcomes.
Great answer, thank you. Dr.
I
Bradford?
agree. In addition to trust, there needs to be more training. And that's where I come in and everyone probably here on this panel. More training in terms of training the next generation of researchers to ask the questions that matter to them, that matter to us, and training us to partner with people like everyone in this panel so that we can ask the questions that matter. So in addition to trust, training is another key piece to health equity.
I'm going to go, can you hear me? I'm going to go a little differently because Dr. Sodike put it in the room, and it's called spirituality, right? Mm-hmm. And one of the things that we have got to do more of, and that is the recognition of our intuition. Because you see, sometimes you can meet somebody and you know that ain't the right person. Mm. You know what I'm talking about.
Yes.
And it does not matter whether they're black, white, red, or green. Yeah. When they're not talking the truth, you gonna know. And so we gotta trust our ability to discern.
Yes.
Thank you very much. I will go back to Dr. Yates and say that we need to really take our time in developing a culture of trustworthiness. Mm-hmm. And that is beginning with the understanding of what trust means. There is no way to have trust without becoming vulnerable. That is to become susceptible. So if one is susceptible, there's 2 views or 2 ways it can go: vulnerability or gullibility. Gullibility means that there's not been a whole lot of attention or education and preparation and training into understanding what's going on. But vulnerability is something we all have to engage. Once we understand how vulnerable you come to trust, then it's just even more incentive for us to ensure the trustworthiness of those who we are trusting, that those people have in place something. And the second thing is, my final statement on this, is that whoever it is that we find to be trustworthy must have empathy and an intentional care. This goes to Dr. Dunn, an intentional care that will kind of vibe with our intuitions. So we must make sure that the persons, the clinicians, the people who we're trusting are trustworthy, and they're empathic and vibe with our intuitions with regard to care.
Thank you so much. Dr. Yates, this question is for you. What is the importance of research from UBR communities or underrepresented biomedical research communities' involvement in working towards health equity?
You know, again, that's a really great question. So I want to take a little bit, step back. So most academics, all right, as far as research, when we train in these research environments. But when you start your career, you normally start your career and you focus on something you're interested in, a problem that you, as a person, you've done all this training, you're in graduate school now, right? But when you get ready to say, I say, open up your own shop and open up your lab or have your faculty position, you are interested because we pour our hearts and souls in this, but you want to ask questions that are important to you. And so, I think the importance of research, of having researchers of color and having researchers, again, that reflect the community, because those questions are not always apparent to everyone, right, that affect minority communities. And so the importance of research is, and we talked about it a little bit in the drug development realm, but it's also in the basic discovery. Understanding basic from the beginning, I think diversity in clinical trials is something we need, but we don't need to wait to a clinical trial to understand whether a drug works in an individual. We need to design that drug from the beginning to work in patient populations, so when we get to a clinical trial, we have the necessary biology and science to justify why a certain community could or could not benefit from one another. And so just to sort of think about research as a continuum and not sort of an end product, but having folks at the table that represent the community that are in the room, because if you're not in the room, we know that story, to make sure that that also is equitable as well.
Great answer. The next question is for the panelists, and we're going to transition from what you just talked about, Dr. Yates. So, panel, where do you think we are succeeding, and what areas need the most improvement when it comes to the collection of data and ensuring we have built an equitable workbench? We're going to start with Dr. Hodge.
Thank you very much for, sorry. All right, where I think we are, where we need to put some focus is in two things. Number one, the clinical trials. We need to spend more time in the education of what this is all about before people get to such places that they are without options, and then give them an option. In other words, what Dr. Shodeke said a few minutes ago when he said the purpose of this community engagement is to begin where we are right now and have a kind of space to train and teach. These things should be going on in a greater numbers across the country, even and begin at an early age. Young people in school, and that's one of the things we try to do at the Bioethics Center, young people in school need to learn and know what this is all about, what a clinical trial is all about. So when they hear the language with their parents, they'll be more ready to participate than to run and hide. If you wait till someone is about to die and say, I'm going to put you in a clinical trial, but here's the informed consent, which you can't understand because the vocabulary is beyond their understanding, but sign this. Who won't sign that? I'll sign it. I don't care what it says. I'm going to sign it. So it's unethical to allow people to be in positions of fear rather than education by starting a whole lot earlier from the womb so that people will be prepared to sign this document when you get there.
Dr. Dunn.
I guess I'm going to be different again. When this pandemic first started, and I remember when I was in the kindergarten and in elementary school, and I learned about the scientific process, I knew that there were certain steps that you're supposed to go through, right? And so when the pandemic came, I didn't see nobody going through that process. And I said, y'all ain't gonna put this in me. I'm sorry. You have not gone through the scientific process. And you have not shown me any evidence that this thing works that you're saying you gotta put in my body. I was on Nightline, ABC Nightline, and I made some similar statements. And so the young man that is the host of the thing near the end, and I guess he thought he was going to trick me because he said, well, you know, the Moderna one was founded by a black woman. I said, I don't care, I don't know her. So when we start talking about issues like this, we must begin to understand the cultural aspects of all of this. Because you see, I was born in the rural community in my grandmother's house. I moved to Tuskegee when I was 4 years old. And I grew up on the campus of Tuskegee, at that time, Institute. So I began to understand this little thing called rural and what that meant, because when we went to see my grandmother and my grandfather, and my brother and the sister and I started saying I is, and we waited for my father to come back and say, no, you don't say I is, you say I am. That has a direct relationship to how you're going to communicate with people. So if you're not going to communicate with people, why are you going to talk to me about a clinical trial? Now, we've heard a lot of things today, and they have been fantastic. If I had heard what I've heard in this 2 days before this thing about the coronavirus and how you were going to cure me and all of the things that you say about what you got to do in order for me not to die, I might have gone through a clinical trial. I might have gone through a clinical trial. But you're going to throw a clinical trial on me now? And I'm worried about whether or not I'm going to die? Dumb.
Dr. Bradford?
You know, when I think about clinical trials and I think about my family, I think about my children, so we're raising children, and I make sure when we go to the physician that our children speak up. When they get about 10 years old, they have to have conversations with the physician. So, you know, whenever the physician asks them what's wrong with them, I'm sitting back and they must answer that question. They're looking at me and like, Mom, you know, and I'm like, you have to start, you know, so we have to start early with these conversations and allowing our children to speak up, because that idea of fear of physicians is a real thing. And oftentimes the physicians are the ones who are presenting those clinical trials to their patients. And so this idea of training always keeps coming up in my spirit, and making sure that we are training our children so that they're prepared to have these conversations.
Can I add something to what you just said? Because I just thought about this. Y'all remember when you were little and your parents took you to the doctor to get a what? See, I didn't even have to tell y'all, didn't I? And that fear often lingers with us into adulthood, so that we trust our parents, but we don't trust that doctor because that doctor did what? Gave us shots. So that's one of the things that we must put into the pot when we're talking about all of this, because we forget about the origins of things, because after you grow so long, you forget. But I wanted to remind you all, that doctor did what? Gave you a what? All right.
And I have to say something in response to that. My mom was sharing with me that when I was about 6 months old, that I was diagnosed with something related to maybe anemia or something like that. And she would take me to a specialist in Dublin, Georgia. I grew up in McRae, Georgia, small town, about 6,000 people. Were you? Oh my goodness.
There we go.
Yes. Small town, about 6,000 people. And my mom would travel to Dublin to take me to a specialist. So access to healthcare, right? Take me to a specialist. And she said every time that we got to the bridge, so there was a bridge that I would cross, I would start crying. 6 months old, I would start crying. And I would cry for, that's a 30 miles. So I gave it to my mom for about 30 minutes. But you're right.
I cried across that same bridge.
Same bridge. Okay, great.
I can't come behind that. Well, I mean, I think the collective though is information. I think we need information at all levels. The one part of all of us to sort of bring it back to this is, and the reason I think they're here, as far as having participation, but information at the genomic level, information at the provider level. I mean, it's just a dearth of lack of information of minority populations. And the wheel keeps turning, and if we're not involved, then you get left out. And so I think information at all levels is key.
Thank you. That helps me transition to my next question, which is for Dr. Bradford, which I feel like that bridge situation is going to help us with this. And the doctors, can you speak to the training or the lack of training when it comes to community-based research by healthcare providers and how that is impacting our communities? And then also, just please let them know what is meant by community-based research.
Okay. So community-based research is research where the community really is coming up with the question. They're working with researchers to come up with the question, and then you answer the question. Researchers usually design these studies based on things that are going on in the community that matter to the community, and then you implement the work and then implement the study, and then that research is brought back to the community so that they know what's going on, and so that they can disseminate it to the community. So that is community-based research. I was not trained in community-based research, but I utilize community-targeted approaches because I'm from a rural space, and I was trained in cardiovascular research at the bench using animal models to study how the heart remodels in response to a lot of different drugs. And one of my passions was really just to figure out how can I take what I'm doing and transfer that information, translate it in a way that the community can understand it, and that we can use some of these community-targeted approaches to blood pressure control. But I do believe that there is more training that's needed for us, especially because a lot of us that are at the bench are not trained to do community-based research. Yeah.
Thank you. So transitioning from community, and I think this is also talking about advocacy, the next question is, what are some ways that we can actually elevate our role and the community's role in advancing health equity? And then do you think people are having these conversations now because of the pandemic, or are you all seeing more resistance when it comes to this situation? We're gonna start with Dr. Dunn. I have a question for you too, though, so I'll make sure you come back.
Can we start with this one now?
Yes, ma'am.
Okay.
Thank you.
I don't think we paid much attention to health equity before the pandemic, to be honest, because we had other issues and matters that were more of concern to us. We used to have John A. Andrew Memorial Hospital, which was the last black hospital to be closed in the state of Alabama. There used to be 127, 129 of them located from the northern part of Alabama all the way down to Mobile. So I was thinking when you raised that question about how I didn't worry about equity, because I didn't have to worry about it, because John Andrew Hospital was the equity. So I felt like John Andrew Hospital was going to protect me and my health and my family's health, so I didn't worry about equity. It kind of bothered us when John Andrew Hospital closed, and I'm speaking from a community's perspective when I talk about this now, but we still had a little bit around the VA hospital, but anyway, we didn't feel totally naked as it relates to being exposed to health in a way that was totally negative. We had Tuskegee University there, and Tuskegee University had all kinds of people that knew stuff. So we didn't still worry too much about health equity. But when that pandemic hit, we worried about health equity. I don't know if this is appropriate time to tell this story, but all of a sudden we realized how vulnerable we were without a hospital, because that pandemic was killing people all over the country and all over the world. Now, I told her I was going to talk about this, so I'm getting ready to talk about it. And that's Norma Jackson, who sits over here to my right, who is now on the city council. She's the only woman serving on the city council. Now, we went to the same elementary school, and I'm a bit older than she is, so we had a little bit of differences around that, but we became very good friends around this whole business about the coronavirus and health equity. So she is the president of the Alabama New South Coalition, and she asked for volunteers to be on what she called the Black Belt Coronavirus Task Force. And I said yes. But when I did that, I didn't know what I was really saying. Because when we had representatives from 12 Black Belt counties, and we started talking together about what was happening in each of our communities and each of our counties, we found out our people were not listening. They were doing whatever they wanted to do, the same way they did before. They were passing blunts, they passed the blunt from one person to the other. They were drinking liquor, they passed it. If they were going to church without mask on, they did everything. And it seemed like our people just didn't care. And that's when I found out about this whole business about trust. Because what we found out was that people generally didn't trust, because you see, that was a white folks' disease, and we were not going to get it. But we knew that that was just not going to work. So we just kept meeting and meeting. And one day, this young woman that was trained under Norma Jackson came up with, she's a lawyer now, and she shared with us that in Dallas County, they were meeting every week, the healthcare people, and they were sharing information. And we went, whoa, that's the right thing to do. We got to bring that to Macon County. And that's what we did. Well, the first thing that happened was when we got to Macon County and we called everybody together to meet, to share, and we thought we were on our way. And one day, Norma called me, and I just want to describe her personality real quickly. She's cool, she's soft-spoken, she doesn't get too excited about anything. And she called me up and she said, Lou, did you see the sign? Did you see the sign? I said, Norma, what sign? I couldn't imagine what it was she was talking about. She said, the sign that went across Tuskegee University, it said, welcome back students, faculty, staff, and parents. I said, what? In the middle of a pandemic? I had already written the president, and I always ask her, I ask her if we could meet and talk about how we could come together as the university and the community, because Norma and I had experienced that, because we grew up in Tuskegee, and you couldn't draw the line between Tuskegee University and the community, the Black community in particular. We were ticked off, to say the least. So we were deciding that we were going to call a press release, a press conference, and we were going to tell it. I said, well, I think we need to call Pebble and Warren, because not only is she a sister, but she is the representative of our area. So I called Pebble and Warren. Pebble also sits on the board of directors or board of trustees of Tuskegee University. And she said, well, hold it, y'all, hold it. Let me call the chairman of the board of trustees. Her name is Norma Clayton. Norma Clayton got on the phone. It was the four of us talking, and she called the president. The first thing the president said to me was, oh, Dr. Dunn, I'm so sorry I didn't get a chance to answer your letter. I ignored that, because that wasn't the point. The point was that it was time for us to come together to talk about health equity and health protection of a pandemic that was getting ready to kill all of us in Macon County, because it's only 18,000 people. 18,000 people. And when you go to other communities, they were wiping them out by the thousands, which theoretically means that Macon County could have had no people left. But the good news is this. We formed the Macon County Community Coronavirus Task Force. And we brought everybody together and we started talking. And we started talking about things that equal health equity. That's why we're not dead. Because we formed that community, that organization. We had no president, no secretary, none of that. We had 4 facilitators, one of which was the president of Tuskegee University. And we formed 4 committees. Those committees: communication, distribution, public policy. Did I miss one, Norma? And the health committee. Now, let me tell you about our health committee. They did the research to let us know what we needed to do, whether or not we ought to believe whatever it was they were saying about that virus, and what we ought to do to protect ourselves. They found all the pictures to let us know what it looked like. The communications committee put together the website, and now we have what is called, what you all got it on your table. Take it home with you. Okay, we formed this newspaper. We can't keep this newspaper now. Why? Because we keep giving information about health equity, and what you ought to do. You ask the question, what you need to do? Ask us, we know. I'm through.
And because they know, I I contacted them to have a conversation because there was a grant opportunity that was out there. The National Association of Black Journalists had money out there, and there was an opportunity for us to partner together and to write about the impact of COVID-19 and the K-12 community here in Macon. And they responded to the call, and with Pastor Manuel, we wrote a proposal together. And students from Tuskegee University were able to receive stipends, and they assisted with writing, and so it was published in this paper as a result of partnering together. Yes.
Big effort.
I would like to personally say thank you for your work, Dr. Dunn and Dr. Bradford, because that really, and that stipend was a blessing. I'm just being honest about that. No, but honestly, the question I had for you, I believe that you answered it, because I was going to ask you about your role as an elected official, but looking at the social determinants of health when it came to everything that was happening.
One last thing.
Okay.
Listen, let me tell you all something. I don't care who you elect to what office. Don't forget to hold them accountable. Because, see, a lot of money came down from the government to do what? To help us do what we needed to do in our communities to deal with the health situation, the pandemic, your salaries, everything. Where is the money? Ask that question and demand an answer. Because you see, I didn't plan to be a mayor. That is not a thing that I woke up and said, when I want to be a mayor when I grow up. It was purely by God, and I ain't going to tell that story. But let me tell you something. If you do not ask your elected officials the pertinent questions, and if you don't sit down and tell them, if you give me the wrong answer, you're not going to be elected anymore, and mean it, organize for it, then you deserve not to have what you're supposed to have. I'm talking about standing up, being strong, organizing, and putting the right people in the right places. That's very, very important. It means your life. And that's one thing that I learned, the direct link between the politicians, the money, and your life. And if y'all don't remember another thing I said today, I want you all to walk out this door and look at your elected officials and have them understand that you mean business when you ask those questions. Don't be afraid.
And I have called on those elected officials several times as a researcher to partner and help us solve some of these problems that we have and address some of the issues that we have in the community. And so the city manager, myself, Dr. Shodake, 3 other major institutions, 2 other HBCUs, we wrote a proposal together to address the issue of not having prenatal health care in the community and the impact that that has on cardiovascular disease. And so it was not funded, but the effort was there. The proposal is still written, and we're going after it so that we can address some of these issues in rural communities and hopefully be a model for a way to utilize this community effort and these community-targeted approaches to addressing health inequities and making for better tomorrow.
Thank you. So, speaking of expectations, this is for the panel, what expectations do you all have for institutions when they are engaging with our community? That's the first part of the question. Second, and what suggestions do you have for science or research communities before they're reaching out to a specific community? And then who should they be reaching out to within that community? Okay. We can process that.
Well, it was a few questions in there. So let's sort of back up. You know, when a researcher wants to reach out to a community, again, I think you still have to start with that trust, right? So I have many folks of my colleagues say, Clayton, I want to do disparity, I just don't know how. I said, what do you mean you don't know how? Right? Well, what they're saying, and I've sort of gotten this over time, is that they don't know how to reach out to the community. They don't know who to talk to. So that means you can't go into a community if you haven't been there and been a part of it. You know, that's just what it is. So you're gonna have to do some, if you really want to do this correctly and gain the trust of the community, you have to be at events like this. You have to be at the church events. You have to be a part of the community, have the community see you and know who you are and gain that trust in order to engage them in a research question. I think institutions, though, have a responsibility as a whole to sort of govern that, right? So institutions, so we have people at institutions, but institutions need to have policies in place that sort of facilitate and guide that process so that the institution as a whole is approaching the community correctly, right, in the appropriate way, and that we have these liaisons, like Dr. Dunn mentioned, where we have stakeholders as a part of the institution, and vice versa, so that we all are understanding the collective needs of each individual pocket, so that we're working together in unison. And I think that example that we just mentioned is the way it should happen. And I've been to those many, many times. You know, I've spoken at those meetings subsequent. I didn't know how that's how it started, though. Okay, so I got a little lesson here, but I've been to.
Don't forget to talk about the fact that you all put us on the strategic planning committee.
Right, and so yes, I did happen to co-chair the strategic planning committee, and for Tuskegee University's first comprehensive strategic plan, and we had the community involved for the first time for the strategic vision of the university. And so again, I think that sort of partnership as far as institution and then individuals at the institution is going to be what's needed in order for us to work collectively together.
Thank you. And I'm actually on the community engagement partnership part of that task force. I'm on that task force. And one of the things that we're coming up with is a strategy to engage with the community. First, really defining what community means to us and what community means to us. When I say us, I live in Tuskegee. So what it means to citizens of Tuskegee, what it means to Tuskegee University faculty, students, what it means to Macon County in general, coming up with that definition. So we're going to be engaging and meeting with the community to figure out what does community mean, defining it, and then having these community engagement studios. That's the plan, where maybe a researcher has a research question and they can bring it to that studio, or someone from the community. That's a researcher has a question that it can bring to this studio, and then we can design these research studies together and think about the implementation of them and dissemination, so that everybody's held accountable.
Thank you. We're right back to the religious community. We can't underestimate the power of the pulpit, the 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 pastors, the imams, whomever your religious leaders are, to engage them. Then there's something else we can do, and that is we could. Someone said it earlier about what it means to be a bioethicist. We need to train grassroots bioethicists. Even epidemiologists need to be trained as bioethicists. Bioethicist is not public, but is more private, and it gives an opportunity to see human beings as humans rather than as just a population-based community. So if we get epidemiologists to think in terms, then we could kind of tase off some of these other issues. When the pandemic first hit Albany, I remember Anderson Cooper got on CNN and he said, "What is happening in Albany, Georgia, is criminal." And I thought about it. I said, "It's not what is happening in Albany is criminal. Is what took place before it got to the pandemic got there. That was the criminality, because you had people who were sitting on morbidities that then became comorbidities. And then you wonder, why were they dying at such a rapid rate? There was a time when Tom Joyner was a part of our community, and this is his home, where he had a thing called Take Your Family to the Doctor Day. And I'm not sure to what extent, how successful it was, but I know some people took their family members to the doctors. So these are things that can be institutionalized, that we could make a part of our conversation and start days like that, especially in April. We could actually push this, that these are the days that you can that young people can actually impact the lives of their family members. But back to the comorbidity issue thought from Albany. If the government knew in New Orleans that the 7th and 9th Ward was vulnerable, all it needed was the right storm. Katrina came, the levees broke, and we had devastation. Another pandemic is coming. It's coming. We should be put all the things that we're talking about right now we should be putting them in place right now. Institutionalize these things so that trustworthiness would not be a factor when that pandemic comes. We would already be at the basis, at the point when we could have conversations like you were talking about, these community-based conversations and say with some earnestness and some integrity and character, let's trust what's in place because we put it there.
What we have done is formed a community IRB. And what Tuskegee University has done through Dr. Sodeke is train our community people so that they understand research and know how to make decisions around deciding who can come into our community and do research. Research is not all bad. Research is good. But which is the difference? Are they researching us for their benefit? Or are they researching for our benefit? And that's what our community IRB does. We've and Dr. Chastity is an example of what we need to do as individuals who are on the faculties of our universities and institutions, and that's to go out into the community. That's very, very important to have and extend that kind of trust factor, because it's going to take, and we've said it all for these last 2 days, it takes all of us to do that. The last thing I want to say about that, and just to remind you, Tuskegee Normal School was the first one to start the National Health, what is now the National Health Week. Started right here in this small rural community that's blown up to be an international thing. But I want to talk to you all about something else. Renovation of historically Black communities. Why are you talking about that right now, Dr. Dunn? I'm talking about it because we have to maintain those communities that belong to us so that we can continue to have the level of innovation that we've had in our past. I'm not talking about eliminating white people from our community, so don't go out here talking about Dr. Dunn said that, because she didn't. What I'm talking about is taking pride in what we have created, and that includes our health care. John Andrew Hospital was started by a black woman who was the first woman to be given a license to practice medicine in the state of Alabama. Booker T. Washington had the nerve to hire her. And she started what we now know as John Andrew Hospital. She didn't stay here but 2 years, but she went out into the community and she did things. That's part of what it is that we need to do. We need to go back and look at our history, and we need to find out that we were some smart people and that we did some phenomenal things. One of the reasons I love Dr. Yates is because his grandfather and grandmother had a flower shop here when nobody else had one in the black community, and that's where we got our wonderful flowers, not only for the funeral, but for our prom.
And Mother's Day. I
Oh,
worked
and
at
don't
Florence
forget
on Mother's Day.
Mother's
I worked at
Day.
that Florence on Mother's Day, okay?
You see what I'm saying? We've got to trust us. I think Dr. Sodicay started talking about that when he started talking about where God leads you. And God led us all together. And my prayer is that we stay together and that we do things that's going to be of benefit together.
Dr. Dunn, you are dropping these gems. You really are. I want to ask, oh, go ahead, Dr. Brown.
I want to address something that you mentioned. You mentioned that the community has an IRB. And so I'm doing what I normally do, which is go out into the community when we have health fairs. So I'm out there, and someone from the community comes up to me, and these are the questions they're asking me. Is there someone taking blood samples here? Who is the PI? Why are these researchers asking the same questions every time? I can tell them why we have hypertension. Are they using the data to further their careers? What are the incentives? Blood pressure cuffs? Gift cards? We require an IRB. And I fell back. And I said, as you should, because you should require an IRB. All these questions you should ask. And we should be held accountable as researchers to the community. And we should be asking everyone that comes into the community, all the researchers that come from other spaces, these questions. And so I wanted to partner with people from the community so that we can figure out what are those fears? Why do we have the hesitation that we have? And maybe we can come up with some new model, some new strategy so that we can move forward, because we have to. I always say, either you're in the clinical trial on the front end or the back end. Either way, you're in it. That's right. So we might as well be in it on the front end and be in it together.
Yes. Thank you. So unfortunately, we are almost at 2 o'clock. I'm very sad. I have more questions, but this is a community event. So we want to ask if there are any questions from the community for our panelists really quickly. I see Ms. Frazier getting up.
You know, Ms. Frazier's going to be asking some questions. But a couple of things I wanted to say. One, we're looking forward to the things that we're moving forward with. And what I'd like to discuss is the IRB that is among our community. And I got up here and I had my whole question, and now it's done left me. But first of all, I want to thank Dr. Yates, who came out. The things that we're looking for are those researchers that are not just researching, but that have a relationship and involved with the community. We're always looking for that. And I wanted to address the fact of the institutionalized, generational, systemic things that we need to look at. There are 3 institutions that relate to persons or individuals that people of color are afraid of, and that's the bank, the doctor, and the police. We are afraid of those institutions Now the police, we know what's going on with the police, but I think on the police level, it's about who we have policing us. And so that's another thing you need to look into. But when you go to the doctor, and many of our older patients are afraid to ask the doctor questions or question anything that the doctor says because you went to school and you know everything. And so if you say it, I'm not going to question it. But we need to teach individuals that they know their body. You know your body better than anybody else if you listen to it. That's why the doctor asks you questions. So that's a training and sharing information that we have to do. And with the bank, I'm going to just say this. When you go to the bank or you go to the store and you've got your card and you give it to the cashier, and as Black people, we sit there and hold our breath like, oh, it went through. Okay, but we need to understand that's our money that's in the bank. It's supposed to go through. I know that I have this money in there, but we do that subconsciously. So those are 3 institutions that we have to work across the board with in training individuals. So it's not just telling them, but it's giving our individuals self-power, that power to know what I can challenge and what I can talk to and what I can say. And I do that because, and I go back to Dr. Yates because Dr. Yates spent so much time with our organization and came and broke it down and did not make you feel like you were asking crazy questions, but engaged you and spoke a language on the level that we could understand. When he told us all about sweet potatoes and what they could do for you and everything, I mean, it was just amazing. And so you would think that he would come as a researcher and he was going to use these 17-syllable words that I'm not going to know or understand, but he broke it down very quickly. And there's others here too, but I just use him as an example because he was so engaging and willing to sit there and talk. He answered every question. Even when it was over, he stayed and talked. And those are the kinds of things that you build trust and relationships with the individuals and researching doctors in our area. So I didn't really have a question. I just wanted us to address those issues as we're moving forward. So thank you.
Thank you, Ms. Frazier.
Thank you.
We have one other question.
And I will be quick.
No, go ahead. Go ahead, Doctor.
No, you go ahead.
No, you go ahead.
Okay, mine is not a question either. I'm kind of like Bernice, but I do. This is from a historical perspective. A lot of that times, PWIs and HBCUs do not take into consideration, and it comes from what Dr. Bradford said. Why are you asking me this question, and what did you do with the data the last time? This research is not new, and I think we need to remember that. There was a sociologist in this area, Dr. Gomillion, but there was also a gentleman by the name of Lewis Jones. And Lewis Jones did extensive research in health disparities in the 70s. And my folk tend to remember, even if they don't say it. How come you come and ask me them same questions that y'all came back and asked me before? So as you do your research, you need to do some additional research. And that is to go back and find out what questions have already been asked of these communities in the 70s, in the 60s, in the 70s, in the 80s, and we are looking at nothing having changed from those initial research projects to the ones we're doing today. And if you don't think that they exist, I invite you to go into the archives of Tuskegee University and find some of that material that's there. I invite you to go into the archives of other HBCUs and see what materials already exist that give you some kind of historical perspective of what we're working with. And I'm done. Bye, y'all.
Thank you.
Hello, yes, my name is Bob Lujano. I'm over here. I'm with the Lakeshore Foundation located in Birmingham, Alabama, with the all of us in alliance with Dr. Allen and UAB. A little bit of a statement, then I think, have a question, although it may be a rhetorical question. I think one of the things that's important, and Dr. Bradford hit it on the head in regards to the community engagement that's really where researchers are going to make the impact, because it's the collaboration within the community, whether it be a church, whether it be, being on the board of directors of organizations. The organization I work for, Lakeshore Foundation, we have about 6,000 people with disabilities, as well as chronic health conditions. And all of us will definitely make an impact because they're coming to Lakeshore Foundation, and those 6,000 people with disabilities will be there. Now, just in regards to disabilities, I mentioned this to Dr. Watson yesterday. There's over 61 million Americans with disabilities in our country. That's the largest minority group in our country, and it's also intersectional. And so at the end of the day, you're looking for the researchers to make the impact. It's going to be through community engagement. It's going to be being on the board of directors of those organizations that have the trust, that have the buy-in already. So, when you do fly in and they see you there, but you're in alignment with this organization that already has the heart of the community. So I guess really my question is, would researchers want to make that step to being on board of directors, to be in those organizations, even if the majority of them are typically all white, maybe not here, but in outside of here? Is that something that researchers would be willing to do? Because I think at the end of the day, you're going to make the impact through policy changes, and the policies typically come from the board. So you really want to make an impact. You really want to make sure that Black and brown voices are heard. It's going through board of directors, and so that's kind of a rhetorical question. But at the end of the day, I'll quote Hannah Nicole Jones in the 1619 Project, and I think it's in the preface, or it might be in the chapter 1, where she says the answer to America's problems has always been through Black people, through Black Americans. That's where the answers are to our issues with slavery. Ms. Wilson mentioned, or one of the doctors, I'm sorry, mentioned the issues with banking and with our police force and things of that nature. The Black community has the answers. It's there. And no doubt the leadership is here to make that happen. So again, definitely proud to be here, thankful to be here. And I'm actually a second generation Mexican American. I'm kind of the white sheep of my family. But at the end of the day, the answers are here, and you guys are definitely moving in that direction. So thank you.
Would two of you like to answer that, or one of you?
Yes, I don't even think it's a question. I think if researchers are not in the conversation, all of this stuff just becomes rhetoric. If we're not enforcing and making policy, we're just talking. So we need to be in those spaces where we could engage, help policy to happen, and let things function. Here's one reason. I was in a discussion in neuroscience at Case Western, and these are some wonderful people. The scientists, it's about prosthetics and sensation in prosthetics and so on. Wonderful, wonderful, wonderful people. And the engineer, scientist, brilliant, brilliant man. His head is down in the laboratory. It never occurred to him while doing the clinical trials for those hands to reach out to someone who didn't look like him. It wasn't because he was racist or anything such. It was his comfort zone, or their comfort zone, and they were sitting in these spaces. And he was absolutely stunned when it was brought to his attention that there are no African Americans in the clinical trials. So if we're in those spaces where policies are being made and enacted, it will put onus on those persons who are in position to make sure they identify and go and look for those persons who need to be in the clinical trials. So it's not a question if we should be in there. We should be in there for sure.
I would just like to add real quickly, I sit on a lot of boards. Okay. I'm even currently the chair of the Minority and Cancer Research Council for AACR, American Cancer Research, as well, and I'm a board member of the American Cancer Society Research Society as well. So again, that has us at the table and numerous ones at NIH and study section panels as well. So I think as participants and researchers in the community, I think that's also one of our responsibilities. Because again, if you're not in the room when decisions are being made, I'm telling you, you won't be counted. I'm in those rooms. I see it happen all the time. I have to speak up. It's definitely you have to be on the board or in the planning committees when decisions are being made. Absolutely.
I'd like to add one other thing too. We'd start talking about policies, as well as in some cases research questions. Take the lawyers out of the room, please, because they are going to write things according to their perspective and their place. That's what they do. They're supposed to do that. Take what the lawyers say and write it in a way that the average fifth grader can understand what it is. And I'm talking about not only are we talking about research, but we're also talking about grants. Because you see, the average person in a community like ours cannot apply for a grant because they don't understand what the heck the thing is saying you ought to do. So I think we ought to really start looking at words and language when we start talking about any of this stuff that we've talked about over the last 2 days. You ask what should we do in the future? Reword stuff so that people can understand it.
Thank you. Thank you for the audience members' questions. Thank you for being here, and this is the conclusion of our panel.
Thank you all so much. And again, I want to just give a round of applause to our moderator. And this is also what the future looks like. And it's so important to have our young people at the table too, because this is where you learn how to lead. This is where you learn how to do this work, where you learn how to serve alongside the people. So I'm so excited to see you here today, because the seeds have been planted for the work that you're going to do and the leadership that you're going to have one day. Because Dr. Yates and us, many of us sat at these tables like this, and we learned at the feet of others. And so I'm really excited for that. And I'm excited that the conversation is going to continue. Although this is the end of today's event, this is not the end of the conversation. And I won't even say it's the beginning of the conversation, because, right. And I'm even careful to not even make it seem like this is the beginning of the conversation, because conversations are had all the time. And I tell my colleagues sometimes, they say, well, we need to begin the conversation. I said, no, the conversations are happening. You just might not be in the room. Or we may be having conversations like you heard today, and we might not have the right people at the table. And so it was so important for us to have these conversations over the past 2 days, to talk about the All of Us research program, but more importantly, to talk about representation matters. Representation matters across the board. It matters in terms of diversity and participants, but it also matters in the messenger and our researchers, making sure they reflect the population as well. So I'm thankful to my team. I really want to give my team a round of applause from the NIH Division of Outreach and Engagement, because we had this vision for this event, and we said we wanted to do this. We knew that we're in the 5th year of our program, and we're now at the place where we're returning health information. We're having conversations about value. And I always caution our program, I said, when we have conversation about value, who defined value? Just because we say something is value doesn't mean that everyone will agree that it's value. So how do we go out and have dialogue, listening to the community about what's valuable? And so I'm thankful to our partners at Delta Research Education Foundation. I want to raise y'all hand, because they're going to be helping us continue to have this conversation and doing a lot of work. I'm thankful to our partners at Pyxis Partners, who will also continue to have this conversation. And I also want to announce that we will be having a conversation and planting seeds and providing some support through our Pyxis Partners to the Tuskegee Macon County Community Foundation, led by Dr. Dunn. We'll also be providing some support to the Macon County Healthcare Authority, and also to Epsilon chapter of the Chi Eta Phi sorority, because we want to make sure that we invest in the community to continue to be able to have these conversations. This is not the last time you all will see us. We will be back. We'll be having these conversations, and we also be working very closely with our Southern network to talk about what do we do next. Dr. Sodike was very clear that you have to do the right thing, the right time, at the right place with the right people. I even think about our researcher workbench. Many of y'all have talked about the need to get researchers here. And the way we met was through the fact that we have this data, and it was very important for us to train the next generation of scientists to utilize that data. And so you'll hear more about that in the research questions that are being asked and the way the community members and participants can even inform those research questions that are being asked. So thank you all so much today. My heart is full. My mind is racing with the things that we have to do next, but I'm charged and I'm energized and I'm committed to making sure that we do this the right way. And I know that you all will hold us accountable. I have no doubt about that. and I love what you said about discernment too, and I believe wholeheartedly in that. I tell people, I said, sometimes I just need to get in the room because people need to feel that you will do the right thing. Not just hear that you will do the right thing, but feel, and feel beyond just what I listen, but feel with our spirituality, our understanding of what it means for somebody to be committed to doing this work. So thank you all. Thank you to our planners and everyone else. And we will be back. And this is not the last you've heard from us. Yes. Yes.
All of us would not be here without you.
That's right.
I would just tell you. All of us it's been happening for some time, but when I've known him since he was a long time, okay? He called me up, Dr. Shodake on the phone, and said, I want to come to Tuskegee. You remember the conversation?
Remember the conversation?
I mean, he said, I want to come to Tuskegee. Let's get on the call. He got all the people in the room. It would not happen without this gentleman here. This would not have occurred. I want to give a round of applause. Thank you for wanting to come to our community.
Thank you for that. And thank you, everyone. And thank you to the facility, to the faith community for allowing us to be here today. And please stop by some of the tables. Some of them are shutting down, but we have information tables in the back. And take one of the water bottles and learn more about the program. Again, have an amazing and blessed afternoon.